Hi there, I'm Amy, and this is Hospice 101. Today we're answering a really practical question. What exactly is provided by hospice care? And how much does Medicare actually cover? This is important to understand because one of the biggest misconceptions about hospice is that families will face expensive medical bills. I'm happy to tell you that the truth is quite different. Here's something that might really surprise you. Medicare covers virtually everything when it comes to hospice care. We're talking about comprehensive medical care, all equipment and supplies, medications for your pain and symptoms, and complete support for your family, with virtually no cost to you. There are only two small exceptions where patients pay anything at all, and we'll talk about those in just a minute. But first, let's talk about everything that's completely covered. When you choose hospice care, you get an entire team of specialists, all working together to provide the best possible comfort and support. Your core team includes 6 key members: a hospice physician, registered nurses, hospice aides, social workers, chaplains, and trained volunteers. We have a separate video called Your Hospice Clinical Team that goes into detail about what each of these professionals does. But what many people don't realize is that hospice can also bring in additional specialists when needed. Physical therapists might help with mobility and comfort. Occupational therapists can assist with daily living activities. And speech therapists help with swallowing difficulties or communication challenges. Mental health counselors can provide specialized emotional support. Dietitians offer nutritional guidance. And pharmacists ensure the best medication management. The key is that these additional services are available when they can help with your comfort and quality of life. And remarkably, all of these professionals are completely covered by Medicare. Now let's talk about equipment. Hospice provides all the medical equipment you may need, delivered right to your home. This includes hospital beds, wheelchairs, walkers, bedside commodes, whatever makes you more comfortable and safe. Oxygen equipment, including concentrators and portable tanks. Special mattresses to prevent bed sores. IV equipment if needed for medications. Wound care supplies, incontinence supplies, and any other medical supplies related to your care. And here's what's really important. There are no rental fees, no deposits required, and no quantity limits on supplies. Medicare covers it all. What about medications? Hospice covers all medications related to your illness symptoms and comfort care. This includes pain medications, anti-nausea drugs, medications for anxiety, breathing treatments, and anything else needed for symptom management and comfort. But here's where we have one of those 2 small costs I mentioned. For outpatient prescription medications, there's a maximum copay of just $5 per prescription. That's right. No matter how expensive the medication actually is, you pay no more than $5. One of the most important things hospice provides is flexibility. Medicare covers 4 different levels of care: routine home care, continuous home care, general inpatient care, and respite care. We have a detailed video called Your Care Plan and Care Levels that explains exactly how these work together. But I want to focus on respite care for a moment, because this brings us to our second small cost. Respite care gives your family caregiver a much-needed break. You can stay up to 5 days in a comfortable medical facility while your caregiver rests and recharges. For respite care, there's a 5% coinsurance fee, which typically works out to about $5 per day. And even this cost can't exceed about $1,700 per year. All 4 levels of care are available whenever you need them, and they can change based on how you're feeling. So here's the bottom line. Hospice provides comprehensive, expert medical care, all equipment and supplies, medications for comfort, complete family support, and 24/7 availability, with virtually no cost to families. The total out-of-pocket expense for most families is usually less than $50 per month, and often less than that. If you have questions about what hospice provides, or want to understand exactly what would be covered in your situation, please reach out to us at EverLight Hospice. We're here to explain everything clearly, with no pressure, and honesty about what you can expect. Because everyone deserves to understand their choices,